Before we start today's episode, I would like to quickly read you our podcast disclaimer. The content in this podcast is for general reference and educational purposes only. It is not meant to be complete or exhaustive or to be applicable to any specific individual's medical condition. No information provided in this podcast constitutes medical advice and is not an attempt to practice medicine or to provide specific medical advice, diagnosis, or treatment. This podcast does not create a physician-patient relationship and is not a substitute for professional medical advice, diagnosis, or treatment. Please do not rely on this podcast for emergency medical treatment. Remember that everyone is different, so make sure you consult your own healthcare professional before seeking any new treatment and before you alter, suspend, or initiate a new change in your routine. Welcome to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets,
two internal medicine doctors who spent years practicing traditional primary care. Over time, we realized something was missing from modern healthcare. A real understanding of how everyday lifestyle choices impact overall health.
We'll help you cut through the noise of the countless health influencers and their conflicting opinions, because no matter who you follow, the basics of lifestyle medicine are at the heart of it all.
Welcome back to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets.
So in today's episode, we're diving into the powerful role that lifestyle plays in cancer. We're going to explore what the evidence shows about how the way we eat, we move, we sleep, and manage our stress really can influence our cancer risk, support us during treatment, and potentially reduce the risk of recurrence. So we're so excited today to have an expert in this. We have Dr. Jasmin Hundal, and she is a hematology-oncologist at Cleveland Clinic and is also certified in lifestyle medicine, and has done a lot of research really focusing on how to integrate lifestyle medicine into oncology care. So we're so excited to have her with us today.
Thank you so much for having me.
Are you able to tell our listeners a little bit more of what got you interested in lifestyle medicine and making that a part of your oncology approach?
Yeah, definitely. So currently I'm in hem-onc, graduating in a couple of weeks. And then I had pursued also a lifestyle medicine during my internal medicine residency. As there is an intersection of cancer treatment, prevention, metabolic health, and survivorship. And that's really something that really drew me into this space. And especially we know that our treatments are becoming very effective, but many patients are living longer, but also with long-term physical, emotional, and metabolic effects of the cancer and its treatment. And when I came across lifestyle medicine, it really provided an evidence-based tool that we can use to support our patients throughout their cancer journey.
I think to get us started, maybe we'll think about cancer in a couple different ways. We'll start with prevention and then look at how lifestyle can impact the treatment and then how we can try to limit recurrence. So when you are thinking about things that just influence a general person's risk of cancer, what type of lifestyle things come to mind?
There's a lot of research done, or we have statements from national societies on modifiable risk factors for cancer. So the most common ones, as we know, are avoiding tobacco use, limiting alcohol, maintaining healthy weight, being physically active, the dietary pattern, which is recommended to be more planned forward, minimizing processed foods, right? And prioritizing sleep, and then basically just reducing sedentary behavior. Those are some of the modifiable factors that we have. And I also want to add at the same time, not saying that cancer is all because of modifiable factors. There are also non-modifiable factors that we need to take into consideration, which are genetics factors and other things that are really not under our control.
Can you help people understand maybe the difference between something that reduces their risk or increases their risk versus something that actually causes cancer?
Yeah, definitely. So risk reduction means you're reducing the odds over time. You're decreasing the odds by eating healthier, let's say, by moving around and taking care of all the other things. You're just reducing your odds. Versus causation is one factor directly causes the outcome. And in cancer, unfortunately, that's much more complex. So there's really no distinctive, where we can say X caused Y. It's very hard to really pinpoint the reason for why it happened. So I think the distinction is really important, because I never want patients to be blamed for their diagnosis, because often we come into that discussion where patients ask, especially our younger patients, right? Why did that happen to me? And then if you think about it, really their lifetime exposure to all these modifiable factors might be very minimal, right? So it's really not something that they cause. It's just inherently that it happened.
Now, for our listeners, I'm just going to pick a specific cancer, and I'm going to pick one that I know you've done more research with. If you have a patient that comes and is high risk for breast cancer, and they have even a known genetic mutation that they are high risk, and they're wanting to do what they can to help decrease their risk over time, what are some of the things that you really encourage patients in that scenario to focus on and spend time and energy to help reduce that as much as possible from lifestyle?
First and foremost, definitely, they should definitely continue the high risk cancer screening guidelines, right? Because there are specific guidelines and they might be requiring every 6-month imaging. So depending on the patient's profile. And then now moving on to the lifestyle, it's really encouraging patients having a planned forward diet, not saying that excluding all kinds of meat, but just focusing on high lean meats and then minimizing red meats and processed meats. As we do know, some organizations have consider red meat as a carcinogen as well, right? Fiber-rich foods are really important. And I'm really excited about the upcoming research with microbiome and fiber coming up and how that plays a role in even in treatment responses. So that's really exciting in relation to immunotherapy. And that research is going on, but we do know a high fiber diet is good. Then the other thing is really paying attention, trying to maintain a healthy weight, exercising if possible, like 150 minutes is usually the recommendation of a high intensity in 300 minutes throughout the week. Strength exercise, I think, is really important as well. Avoiding really alcohol and tobacco. And really something that we don't discuss that much and more research is happening in this space is sleep, right? Because we do know that chronic sleep deprivation or things like that does impact your sleep, does have an effect on our inflammation in our body. So I think trying to have a good balanced sleep. And last but not least, really minimizing stress and social connections. We do know that all those things with social connection and minimizing stress really has a positive impact. Again, like just on that inflammatory cascade where we have some preliminary findings, but we can at least do the best we can do.
On nutrition a little bit more, I think a lot of times people hear about eating a lot of sugar and that can cause cancer. Is there a direct relationship there?
That's a very good question. I think there are also a lot of misinformation, unfortunately, and books out there that really say that sugar feeds on cancer. And the simple answer is really that sugar doesn't really feed on cancer. It's much more complex. We wish that would be the answer. I feel like also all cells in our human body, like on day to day, even in our healthy people who have no cancer, we do need glucose, right? Our brain works on glucose in order to function. So the concern is really not just one cookie or one sweet or anything like that. The bigger issue is like the long-term pattern of excess added and processed foods, and that can lead to that insulin resistance, the chronic inflammatory state that we have. And that's, I think, we're seeing also with the obesity epidemic that we're having, right? Like where we are having more than half our US population is becoming obese. It's not really just one time. It's like over the time. And sometimes the sugars are hidden. So sometimes like we really don't even know what we're exposed to. Really just minimizing and staying away from processed. I always recommend if you cannot identify from the label like what it says, then it's definitely a processed item. So it should all be maximizing whole-based foods.
And then also on this note, I know that there are many people that are reaching for different supplements that are out there or even different blends of veg and whatnot. Is there any current literature that is showing that there's benefit in a preventative standpoint going that way, or should we still be focusing on just our actual food pattern?
Yeah, I think unfortunately there's no really evidence, especially in the supplement world. There's no real regulation that we have right now. So you don't know what's in your mixture, if there is any contamination. So that's usually the number one risk, right? There is some basic research done on preliminary mouse models and translational research that kind of like specifically maybe show beta carotene and tomatoes and things like that, like extracts, but it's very hard to translate into real world, right? So again, really just focusing on food, like real foods is right now the way to go. And I'm really just, as I said, hopeful for the future research in the microbiota, because prebiotics, I think, might hold a promise. But again, the research is still going on and more answers in that field.
Another one I hear a lot of times brought up is fasting and can reduce cancer risk. Is that something that you feel is well researched?
So fasting is actually really interesting and intriguing, because fasting is not something new, right? It's been happening since ancient ages, and it's in some cultures intrigued in their culture. And some research has shown benefits of fasting during chemotherapy. Then there's something called fasting mimicking diet and all those things. And again, those studies are more on a smaller population base. And then there are also very mixed results of those. And with fasting, we really also have to pay attention, especially during chemotherapy, where patients might be already having a decline in their appetite, which is then leading to weight loss and cachexia, what we call, and then they are at risk of protein deprivation and things as such. So that it's like a mixed field. So right now there is some encouraging results showing that it might help. And then I think in a normal population-based studies, there has been some studies shown that those fasting mimicking diets and things have an impact. But again, we really need to pick our patients who are correct for it, and then also need more research. So I think overall, I'm just hopeful that with digital health and all those advancements that we have, that we are more comfortable doing clinical trials where we can monitor patients more closely if we end up choosing fasting, so that we are able to monitor our patients and do studies as such.
And when it comes to looking at things like obesity, is it really the thought that it's the obesity itself that increases the risk of cancer, or is it what you're eating that results in obesity that then ends up in cancer, or both?
Yeah, I think it's a complex thing. Again, it's not one or the other. I think it's definitely the inflammation, the inflammatory pathway that gets activated with that in itself, right? So we do know from studies, especially even in patients with visceral adiposity or excessive adiposity, that it contributes to the chronic inflammation, insulin resistance, and alters the hormone signaling that we have, and changes in what we call adipokines, which are like the leptin in the fat cells, and just the whole biological environment is dysregulated. So that just causes an increase in the inflammation. There has been some interesting research coming out too, where they studied normal BMI patients, but they had excessive abdominal or visceral adiposity, and those were also showing that increased inflammatory pathway. I'm not really a big fan of the BMI. What I'm really interested is in the body composition, because that can tell me what is the visceral fat, what is the muscle mass in my patient, and can accordingly advise our patients what to do.
Now, is that a tool that you are currently using with patients and getting body composition?
So unfortunately, it's not much used, right? But it is used in some clinics, right? Especially in weight management clinics right now. The Breast Surgery Society uses body composition for lymphedema risk assessment and has now formally recommended in their guidelines. So in patients getting surgery, that will be implemented. But again, it's not in relation to what we're talking right now. So I'm hoping, again, it's really just the insurance coverage and whatnot. So I'm really hoping that the more awareness we have around this topic, that we get more coverage and our patients are able to get that. You can purchase it, right? You can get it. But again, if it's more regulated, I think it'll be much more powerful.
Another question that I get a lot is asking, how have we determined that processed meat and red meat is increasing cancer risk? Because I know that a lot of times the question is, it the meat itself, is grass-fed better? In kind of navigating that for patients that are trying to reduce their risk, what is your usual take on that?
Yeah, so like studies that have been done, there were observational studies as well as some lab translational studies where there was a concern that processed meats such as like bacon, sausages, hot dogs, and dairy meats were associated with increased risk of colorectal cancer. I think that's where we had the strongest signal. One-time steak or one-time, as you said, intake is not going to be the issue. It's going to be the prolonged exposure to it, because again, it's like more of the accumulation rather than elimination totally, right? So as you said, if you want to eat, then just prioritize maybe organic. Again, just making sure organic could be also a buzzword. Foods, red meats that are as clean as they could possibly be, and just stay away really from the packaged foods, from sausages and hot dogs, which are like just packaged and with preservatives again. And just prioritize maybe going to the butcher who does not use preservatives, things as such.
And you mentioned how important sleep was. Is it the same guidelines we usually recommend in lifestyle medicine, 7 to 8 hours, or is there any other additional research as far as cancer goes that we need to be doing more?
Yeah, no, it's the same. And there has been research showing like less than 6 hours, and I think greater than 9 hours can actually cause the opposite thing, right? Because you don't want to have excessive sleep. And again, that goes back into how studies have shown that the circadian disruption, the mechanism with the disruption of melatonin, can lead to immune dysregulation, metabolic abnormalities, and the normal DNA repair mechanisms. And those studies are mainly observational studies from night shift workers, and then kind of looking into translational studies where they have seen that there are stress factors. Important is really just consistent sleep routines when possible. Light exposures and healthy meals can really help with the sleep as well.
Could you just talk a little bit about, for someone that maybe doesn't know, that our body is constantly assessing any DNA damage that could lead to cancer and repairing it, and that, can you explain that a little bit better?
Yeah, so we definitely have a continuous DNA repair mechanism, right? We do have that. We have the checks and balances, and that's why mutational mistakes happen all the time in our body, right? And then we have our DNA repair proteins and mechanisms that are in place that are able to come in and clean up. So we have those in place. But sometimes what happens is there's a mutation that kind of disrupts the DNA repair mechanism. So it's not repairing the machinery anymore. The genes, like where they become dysregulated, and that's when you see cancerous cells or cells that are not working properly, and then hence disrupting the whole other cascade.
Yeah, I think it's a good way to think about it when you're thinking about how important lifestyle is, just that your body is constantly having to keep check on things and repair things that could lead to cancer. So the more you can keep your body in a good shape to do that action for you, the better off you're going to be.
Yeah, exactly.
Let's talk about someone that actually has the diagnosis of cancer and how you would approach lifestyle for that patient.
So I feel like during the treatment, the goal shifts from prevention to support, I think, as well. So we just want to maintain and we want to reduce the risk of further complications or new occurrences. That conversation shifts in that perspective from the prevention. But the prevention still maintains, because you still want to prevent the onset or worsening of any comorbidities they have or new onset of cancer. So the focus is really on just maintaining of current strength, preserving muscle mass, and then just focusing on nutrition and reducing fatigue, because tiredness and fatigue is one of the major issues in our cancer patients. Also, one of the ones that is much more underdiagnosed, because it's really hard to diagnose fatigue and or give treatment or prescriptions for it, right? So I feel like just really helping our patients to tolerate the treatment as safe as possible. That's usually my goal. And then also keeping them from getting any recurrences or progressing. So that's usually where the focus is.
I feel like for some patients, and obviously we're talking very broadly here, many times in cancer treatment, patients are told just eat whatever you can and rest, you're tired. Do you feel like there should be a kind of a change in some of that messaging, more encouraging of making sure you are moving or thinking about what you eat? Or is it still just that same philosophy when you're using lifestyle medicine?
No, I think we're moving a little bit away from that. And like, it's just like having realistic expectations, what it all comes down. Chemotherapy days are going to be tiring. They're long. Some patients might have worse side effects than others, right? No two people are the same. So it's really just having realistic, not beating yourself. So it's really just some days, maybe just a small walk, maybe just a few steps in the house or outside, just focusing on our hydration, right? And being able to eat if they can. The focus is on adequacy sometimes during treatment because of the nausea they might be having, or the fatigue or tiredness or the sleep, or all together. So it's really just maintaining enough calories, and then like also not forcing. We as caregivers want to support our loved ones, and sometimes we're just a little bit forceful, like you have to eat. just if the appetite is low, just smaller frequent meals, smoothies, soups, and all nutrition supplements can help with that. And I think like our oncology dietitians are very helpful in finding like tips and tricks, like how to change something, because our taste buds definitely change with chemotherapy. So being aware of that is, I think, very important too, because the taste buds are changed, and depending on your treatment, chemotherapy or a targeted agent, that might be worse in some patients or others. It's a balance. It's hard, right? Because sometimes, sometimes if I'm on my BMT transplant rotation, at that point when the patient is having oral lesions and things as such, I want them to have the popsicle, right? Like I know it is going to have sugar, but I really want my patient to have the magic milkshake and the popsicle. So it really depends on what situation we are in which phase we are, to be honest. So the recommendations will really vary, and that's a personalized medicine comes into play.
Do you see any myths coming up frequently about what patients should be trying to eat during treatment?
I think there, as you had alluded, I think the myths like is definitely the sugar feeds cancer, right? Or eliminating all types of carbohydrates, the fasting, right? Some natural supplements or herbs might be out there that are being advertised. Those are usually the common ones. There are other treatment modalities are coming out there too. Again, we just don't know, and some of them could be dangerous. So it's just having a really upfront discussion with your oncology team, I think, is really important.
And if someone is handling chemotherapy pretty well and their appetite is okay, is it okay for them to continue a pretty rigorous exercise regimen, or should there be any restriction on that?
Yeah, it really, again, really depends on the patients and how their exercise is usually safe and beneficial during treatment, right? But when it really depends on what kind of chemotherapy they are on, what kind of cancer are we treating. Blood cancers are have a higher effect on their blood counts and all of that. So it's really, again, a very personalized advice, right? Because everybody will have different type of risk factors during active treatment. But overall, really, exercise can really help with the fatigue. It might sound very counterintuitive, actually, but really, exercise can reduce fatigue. And I have seen it in our patients where they are fatigued and tired or have aches and pains. And when they notice they start exercising, or even the first thing in the morning, if they go for a walk, it actually improves it and the fatigue decreases. Again, slow and steady, right? And really discussing your risk factors with your team is really important, because, as I said, it really depends on your type of cancer and treatment.
Is there any current literature for specific ways to manage the stress of oncology treatment, or things that you have found even successful with some of your patients for modalities of helping with that?
So right now, CBT, cognitive behavioral therapy, is something that is definitely has been a gold standard for sleep and stress. Exercise is usually another recommended thing for managing stress, right? So I think those are really important. There is music therapy. There's some supportive care cancer centers usually have, which is called art therapy, music therapy. Those are just some supportive measures that we can give or recommend to our patients, and that really sometimes helps. And again, just providing a supportive environment is so important.
And I think this is one of those cases that probably most people can see where having social connection would be helpful and social support when you're going through something like this. For people that don't have a big network of family or friends to help them during this time, where do you usually guide them to look to get more support?
Purpose and community really helps our patients to move from simply surviving to rebuilding life after cancer. And I've seen in patients that are able to find their community, it really supports their accountability, hope, and emotional healing. And unfortunately, sometimes some patients really don't have that, right? There are usually local support groups, right? And each cancer center usually has recommendations. And then there might also be American Cancer Society and specific cancer-specific type of societies, right? They also have resources for patients that we can refer to, and where we can find communities that might be undergoing a similar treatment or a similar phase as my patient in front of me. So I think those are really helpful. And then I know my patients always mention their Facebook support groups too. There are a lot of resources out there. And if you have any difficulties finding or you want some guidance, definitely, I think the big national societies like American Cancer Society and such others are a very great resource, or Susan Komen for breast cancer that can provide you with recommendations.
And for patients that are, let's say it's someone that's really health conscious and always has been and has always been very diligent about their lifestyle and habits, do you have any advice for those people on what they can try to take the focus off of?
Yeah, so you meaning somebody's really on a regimen and now it's a curveball? Yep, definitely. I have a loved one who actually is like that. So sometimes you just have to take a step back and take it day by day, right? Because sometimes you're so used to working out, exercising, and running all the errands, and then this is a setback, and then they feel bad, but they still keep going because they're just used to that pushing. But really, like cancer and treatment can really cause significant fatigue and tiredness. So really, just listening to your body is sometimes important. As I said, it's kind of like a seesaw balance with, like I just said like a few minutes ago, that exercise and moving around and doing all of the other things are so important. It's really just like finding the balance. You don't want to like exert yourself, but also not underexert yourself. So you just have to find your own balance.
And for someone that's trying to learn more about it, whether they're looking at prevention or recurrence or treatment, and they're feeling overwhelmed, let's say they're looking on social media and they're feeling overwhelmed by all the information they're getting, what advice do you have for them on how to get good information?
I think the American Cancer Society does a really good job in providing some bite-sized information and then more links to in-depth information as well. Then again, like specific societies, right? Susan Komen for breast cancer has really good recommendation. Then the American School of Sports Medicine, they have really good recommendation as well. Or AICR, American Institute for Cancer Research. They really have good resources as well. And then American College of Lifestyle Medicine, there's also some good resources out there.
And now that we're having so many young patients that are receiving treatment and reaching remission, what kind of support is being built around to help these patients stay in remission and things that they should be focusing on as well?
There's usually a survivorship plan and team in most of the oncology cancer centers. And I think that is where we need more work on, I think, truly. And that's where my passion is, to be honest, building robust implementation programs, not just one visit at the end of treatment, because survivorship really starts at the day of diagnosis. So those are like, some programs are stronger than others. And sometimes some patients, unfortunately, have to take more ownership to get what is needed. And again, that just doesn't come really to your oncologist only. It's really the system overall. It's like the insurance, the payer, and then also it is a multi-causal thing why this has not been implemented as robustly as we have our cancer treatment regimens, right? We know it in and out, and we have an algorithm, and we have all that. And with survivorship, it's a little bit lacking. So I'm hoping that in the future, with all the advancements that we have, and then with the increased survivorship and treatment advancements, we can focus the lens on that.
If you could dream up the perfect survivorship program, what would be things that you think are critical to include for these patients?
Once we start talking, once we have the gist of what's going on in my cancer patients from the time of diagnosis, to get their chemo education, and the next visit is going to be the multidisciplinary lifestyle medicine team discussion where the patient would get their personalized care plan for during treatment, and then they will have touch points throughout their treatment, of course. And then once they finish the active treatment, again, the whole multidisciplinary team comes together, comes with a care plan for the next 3 months or 6 months or whatever, depending again on what situation we are in. And really, that will be my ideal, right? Really picking it always back after an oncology visit. That will be the ideal thing that I would like to see.
Do you foresee things changing that way?
That's my hope, to be honest. You know what I mean? And I feel like we are already seeing a trend, and I think our patients are wanting to see that. So I think we really need patient advocates demanding it as well, so that really policyholders, policies can change. Patients can get coverage for all those things that are needed or recommended. We get more research grants and funding into the space, into the implementation space. All of those things I think are much needed. And then I think for that, awareness is needed. And I think we all need to really work on that all together, like not just clinicians, but everybody.
Yeah. I feel like
patients that have survived cancer are usually such a motivated group to make lifestyle change, and they really have a new lease on life and want to do those things. So I hope we can give them all the resources they need on that. Are there any things that you see come up in social media for that group of patients that they tend to do that could be damaging?
I think, unfortunately, starting on supplements and like that trail, sometimes I've seen it firsthand where it like damages your liver and then we have to stop your treatment, right? And then things like that are really worrisome sometimes. So I think the supplements is really the one thing that kind of really is concerning.
Now, I know more recently there's been a lot of encouraging research related to exercise and remission in cancer patients. Could you comment on that? Because I just find that so empowering to many of these patients.
Definitely. We actually had our first phase 3 randomized clinical trial presented, and it was last year, actually, which was structured exercise after adjuvant chemotherapy for colon cancer. So in that phase, patients were randomized into either a supervised structured exercise program versus just regular health education material over a 3-year period. So these patients are patients that have finished their primary treatment, right? So that's our patient population that we looked at. And at about 8 years, the disease-free survival, meaning they were free of cancer, they were significantly improvement. And then the 8-year survival, overall survival was 90.3% versus 83.2%, meaning there was a 7% difference in patients who were involved in the structured exercise program. So that's overall survival signal, which we actually always look for treatments in our chemotherapy. So having a 7% change with exercise is tremendous success. So
You would prescribe it to everyone.
exactly.
And can you tell us a little bit more about the promising research that's coming in the realm of the gut microbiome and how that may affect how people respond to treatment and recurrence?
Yeah, definitely. There's some research going on in the renal cell carcinoma and the kidney cancer world with the immunotherapy modulation during treatment with immunotherapy. Then there's a MSK studies going on with blood cancers as well, which has shown some benefits in progressing to different stages of their cancer. So the research is ongoing. It's just very difficult to do microbiome research, right? But it's promising, and there are probiotic studies going on as well. Most of the advancements, I think, are happening in the immunotherapy world right now. But there's also some studies that are people looking in patients who are experiencing more hot flashes, for example, in our breast cancer patients as well.
And any guidance on just as people get through treatment and or get back to regular life and get super busy again if they slow down, just on how to keep their stress lower?
That goes just back to like mindfulness. Mindfulness-based exercises have definitely shown it is evidence proven. So mindful-based exercises are very important. Journaling, again, finding your community, and then just exercising and overall trying to maintain a healthy lifestyle is really important because things will be different. And it's sometimes hard to be back to the life that you had before the diagnosis.
Anything you think we're missing that we haven't brought up that you feel like you're always saying to patients that you want to make sure that they hear?
Yeah, overall, I think we went over a lot of things, right? And I think it's really what I really would want to reinforce is, again, it's not you didn't cause the cancer or no specific one thing caused the cancer. It's really a complex mix of like biology, genetics, environment, aging, and exposures, which we still don't fully understand, right? So what we can focus on is really is how we can support our body during treatment, after treatment, and in our recovery phases. So I think having that message is really important.
I think that's really just a great way for us to all think about it. Thinking about cancer can feel very overwhelming and very scary. And thinking about how can I just best support myself no matter where I am, and that is a great way to think about it. Lifestyle medicine gives us such a good roadmap to be able to start making changes. I guess one other thing would be, do people need to do everything perfectly, or do little changes help in the realm of cancer?
I think little changes help go a long way because they'll compound over time.
This has been great. Thank you so much. And we hope everyone can take one small step today to work on a habit to reduce their risk of cancer.
Thanks for tuning in.